Hi, I'm Christopher Yeung. I'm a spine surgeon in Phoenix, Arizona, and I'm going to be talking to you about full endoscopic spine surgery. So, what is full endoscopic spine surgery? This is basically using an endoscope to visualize the spinal pathology that you're trying to treat. So, this is unlike some traditional minimally invasive spine surgeries where you're using a microscope or surgical loops for magnification. So, you're substituting this for an endoscope. So, these are typically rigid lens-based endoscopes. You can get excellent 4K or HD resolution in the modern endoscopes today. These can be placed through a small tubular retractor, about 7 to 8 millimeters, which really limits the tissue destruction. So that leads us into what are the benefits of endoscopic spine surgery. So endoscopic spine surgery is alternatively been termed ultra minimally invasive spine surgery, and that's because of the very small incisions and cannulas that you require to do this spine surgery. Again, 7 to 8 millimeter cannulas, and you're only using tissue dilation to access the spine. Thus, there's less tissue destruction. You're not cutting any muscles, you're just dilating through it. You're causing less blood loss, and that leads to quicker recovery and an earlier return to work. So there's some advantages for the patients. This leads us to who's a good candidate for endoscopic spine surgery. So traditionally, this has been for simple decompressions, such as discectomies and/or bony decompressions for stenosis. Typically, there's two approaches, a posterolateral transforaminal approach or an interlaminar posterior approach. Foraminal herniations and extraforaminal herniations are the ideal candidate for the posterolateral endoscopic discectomy because that's right in line with the approach trajectory. Additionally, small contained herniations or caudally migrated small herniations can also be accessed in the epidural space. For the interlaminar endoscopic procedure, an L5S1 extruded and sequestered herniation with caudal migration is the ideal candidate because you have a wider interlaminar area and easy access to that with the posterior approach. Additionally, there has been some work with using the endoscope for interbody fusions, which has the advantage of verifying the adequacy of your disc preparation and end plate preparation. And we have some new implants that are able to expandable implants that can go through the tubular cannulas and achieve that interbody fusion. So bottom line is endoscopic spine surgery is evolving, and it's continuing to evolve with the technology, and it's an exciting subset of procedures to be able to offer your patients in the future. Thank you very much.